Joining us this morning, coming over from Oklahoma City, is Ray Walker. He's the director of the Oklahoma Insurance Department's Medicare Assistance Program. Ray, thanks for being here with us.
Thank you.
You can provide a lot of assistance. Medicare open enrollment runs now through December the 7th, and plans change every year. So what do people need to know as they tackle this again for another year?
It's really important that people take this opportunity to review their current drug coverage. Even if the plan that they were on for last year gave them really great coverage, that doesn't mean that there's not a new plan that's available this year that might cover their prescriptions better or at a lower cost. So we encourage them to take this opportunity to do that review, check out what's available out there. Also, their physician may have prescribed something new for them this year that's not on the formulary. That's the list of drugs that are on that plan. So we want them to take this opportunity to make sure that they're saving as much money as they possibly can. Seniors are on a fixed income most of the time, right. So anything they can do to try to save money for the coming year is a good idea.
The Medicare Assistance Program has had a lot of success lowering the cost. You say you average a savings of about $1,500.
$1,500 to $2,000 for those people who take the opportunity to review their plan and stuff. So we can't always save everybody some money, but usually we can find something that's going to give them some savings for the coming year.
And it can be very confusing, can't it? Trying to make sense of all the rules and the regulations.
Absolutely. You know, when Medicare first started back in 1965, there was only Part A, which covered your hospitalization, and Part B, which covered your outpatient services. Now they've added Medicare supplement policies, Medicare Advantage plans, which are the HMOs and the PPOs and stuff. And then in 2006 is when the prescription drug plans started. So now seniors have a lot more flexibility in their options to receive their Medicare coverage, but it also makes it incredibly confusing.
In fact, there are 28 individual prescription drug plans, 30 different Medicare Advantage plans. How do you help Oklahomans figure out which is the best plan for them?
We use a tool that's provided by the Centers for Medicare and Medicaid Services through the web, and we can put in their information as far as what prescription drugs that they take. We also list the pharmacies they want to use, because most people have specific pharmacies that they want to stick with. We put that information into this computer system, and it will generate a list that tells us which plans are going to provide them with the best coverage at the lowest cost.
And you say even if people are happy with the plan they have right now, it's wise to get a second opinion.
Absolutely. We have a tendency to treat that coverage the same as we do our homeowner's policy or our car insurance policy. We get it and then we try to forget about it. That's not a good idea with your health care because, as I said before, there are so many different options that become available each year. It's a good idea to just talk to somebody. If people want to talk to someone locally, Life Senior Services right here in Tulsa is one of our contracted partners. And they have a wealth of information about anything related to Medicare.
Where else can people go if they have questions?
They can contact us, 1-800-763-2828. Someone answers that phone 24 hours a day, 7 days a week. Life Senior Services is a partner. Grand Gateway, Area Agency on Aging up in the Big Cabin area. They're also a contracted partner that can help people in the local community.
All right, Ray, thanks for coming down from Oklahoma City.
Thank you.
There's a lot to think about.
Thanks.
Appreciate it. Lisa?